Thank you for being here. Today we're going to talk about one of my favorite topics that I used to lecture on, inflammation, and why I always covered it at the beginning of the semester in a course called Pathophysiology, because it really was part of every body system, and it was often the root cause of many chronic diseases. So I believe that if you really understand inflammation and what causes it, you can really make significant changes in your health. So let's get started. What if I told you that your afternoon sandwich, your breakfast muffin, or that healthy granola bar you ate as a snack was fueling the inflammation that's going on in your body, contributing to fatigue, joint pain, obesity, brain fog, or even worse, chronic diseases? Hi, I'm Dr. Rose Petrilla, the Primal Professor, and today I'm pulling back the curtain on what excess carbohydrates really do to your metabolism, your immune system, and ultimately your health. Stick around because once you understand the science behind inflammation, you'll never look at a carb the same way again. The itis is the suffix that refers to the inflammation. A tendinitis, right? We've heard of that. And inflammation is a normal defense mechanism. And our body, when this is occurring, gives us signs and symptoms. And it's usually a warning sign. It's not the same as an infection because you can have inflammation without an infection. You can just have tissue injury. But infection is one of the causes of inflammation. Because we said inflammation is a defense mechanism, I think we need to understand first how does it defend us? Well, we're going to break this defense mechanism up into two different sections, non-specific defenses and specific defenses. So the non-specific defenses are fluids like tears, saliva, mucus, and gastric acid in our stomachs. So imagine the pathogens we bring in with our food, right? And it could start in the mouth, and it certainly in our stomach is so acidic that a lot of things can't live there, right? And so that's the beginning of our protective mechanisms. We also have the skin, and that's a barrier to the outside world. It's keeping pathogens from getting inside. And we know once we have an abrasion or our skin is open, that can become infected very easily. I'm sure we've all experienced that along the way. And then the third non-specific mechanism or defense mechanism regarding inflammation is called phagocytosis. I'll explain it a little bit later, but it's part of the immune response when white blood cells are triggered to attack an area of infection or injury. And then let's now talk about the specific defenses. I don't have it on this slide. However, we have natural immunity that if our mother breastfed, that she passed through her breast milk with us. And that gave us immunity while we were breastfeeding. Then there's cell-mediated or humoral immunity, it's called. And it's so fascinating when you think about it. Essentially, I'll give you an example. Let's say you had chicken pox when you were younger. You had that virus come in your body, and your body then fought that and launched a defense. And the immune system actually has memory cells. So every other time you came in contact with someone with chickenpox, you may not have even known it. You could have been in a grocery store. You don't know. Your body immediately recognized that pathogen and launched a specific defense towards that virus. Amazing, right? At least I think it is. And all the defenses are there to overcome injury and disease. So, what are some of the causes of inflammation? Really quick, physical damage like a cut or a sprain. You can come in contact with some kind of caustic chemical like acid or drain cleaner, and it burns your skin. Ischemia or infarction. Ischemia is a lack of blood flow to an area, or and if that tissue dies, then it becomes an infarction, like a myocardial infarction. You can have allergic reactions. If you've not had one, you watch somebody have one, you can see, and this is my best example, you can see the person's nose and start running, their eyes start tearing, they're sneezing, their nose is getting red, their eyes are swelling up, no matter where the inflammation is going on. Now you can see that because it's running, their nose is running, but that same thing is going on in your knee if you have arthritis, believe it or not. You can have damage caused by extreme heat or cold, a burn or frostbite, foreign bodies like a splinter or step on a nail or glass, and then finally infection. These are all causes of inflammation. Now, take a look at this slide. It really helped my students to understand inflammation. So I am a physical therapist and professor of physical therapy, so we treat a lot of inflammation. We, of course, treat tendinitises and bursitis, but we treat somebody in this particular picture who has cellulitis, which is an infection of the skin. We see it all the time. And acute inflammation is a good thing. We need it. It helps to defend our body. But I want to go through that process so you understand it. And what we don't want to happen is for inflammation to turn chronic. So let's start with acute inflammation. So there has to be some kind of infection or injury, okay? And when that happens, it triggers the release of chemical mediators. Chemical mediators like histamine, the kinins, or prostaglandins. So I just gave a little bit ago the example of an allergy. Okay, so now I'm going to go over, we'll use that as the example, the 4 physiological responses that occur because of this injury or infection, okay? The first thing that happens is that the body, if you take a look at that person's left leg, if there's an infection going on there, the body is going to send blood flow to that area. That's called vasodilation because it wants to launch an immune response. So it's trying to get all the necessary cells to that area of infection, and that's called vasodilation. And what that does is increase blood flow. And so what we're seeing there is the redness is caused by the increased blood flow. And if you touch that leg compared to the other leg, it would be very hot. And that's 2 cardinal signs of inflammation: increased temperature of the part and redness. And that's because of vasodilation. The next response there is increased capillary permeability. So the capillary is the smallest of the arterial vessels that's bringing the final glucose, oxygen, nutrients to a particular tissue. And all day long, we have sodium and potassium, oxygen, carbon dioxide going in and out of tissues into the blood to be disposed of. All different things are happening to the kidneys, through the liver. It's going in and out of our tissues, out of our cells, back into the bloodstream and the lymphatic system. So when we have an injury, the chemical mediators of inflammation will cause those openings in the capillary to get bigger, meaning they're more permeable. So fluid can go out of the bloodstream into the tissue that's been damaged. Okay, and then that will cause swelling, and the medical name for that is edema, and it will cause pain. So there are 2 other cardinal signs of inflammation. We said heat, redness, pain, and edema or swelling. And the third physiological response that from the chemical mediators is called chemotaxis. And that's just a fancy word for saying white blood cells being shuttled to that area to defend any pathogens that are in there. And what you'll find, like if you had appendicitis, is that when they take your blood, that's part of the diagnostic tool. So you'll have an elevated white count and a pain in your right lower quadrant. So the body's sending white blood cells to get rid of that. And then the fourth and final physiological response is irritation of the nerve endings, and that causes pain. So as part of that chemotaxis, you have those other cells, the white blood cells and a special white blood cell, phagocyte, and they're going to come in. It's like, I'm going to date myself here, like the little Pac-Man come, and they're going to eat up any debris from damaged cells or pathogens and clean the area and prepare it for healing. So you get the clot that forms from the fibrin mesh with platelets, and then you're also cleaning up the debris, all in preparation for healing. So just to review, the cardinal signs of inflammation, and it's our body giving us these signals. Sometimes they're really obvious, but I'm going to give you situations where they're not so obvious. But there's redness and heat, swelling, pain, and usually wherever the area is a loss of function. So your ankle might not work right after the sprain. But imagine if it was an organ. Imagine if it was your liver or your pancreas. The same thing can happen, but the signs are not as obvious because it's inside. I want to blow up the lowest part of this slide. This is the part I really want you to understand so that you can make informed decisions and really know how food can be healing and reduce inflammation, or how food could be the villain here and really increase inflammation. So that fibrin mesh, that clot forms, we have phagocytosis occurs, and now can the body heal? That's ultimately what acute inflammation is for. It's to help the body heal again. So what we don't want to happen is that the inflammation turns chronic. And what do I mean by that? Well, you sprain that ankle, right? And if you elevate it above your heart, put ice on it, wrapped it up, used crutches, then that tissue is going to have a chance to heal. But if you keep walking on it and keep re-injuring it, then it's going to continue to be inflamed. And as a result, it will probably form scar tissue. Now, let's start with the healing side first. There's 3 options for healing. I'm going to start with the one all the way to the right, resolution. That means that damaged cells were not damaged enough that they can still recover. So let me give you an example. Let's say there was a drowning victim and they were under the water for 2 minutes, and somebody saw it and pulled them out and gave them CPR, and they started breathing on their own within a minute or 2. Wonderful. Did some of those cells in their brain swell a little bit from a lack of oxygen? Probably, but not enough to cause permanent damage. So the cell can recover. That's great. The second option there in the middle is called regeneration or replacement by the same type of cell. Now, however, if that happened to the skin, and I had a burn here, I ironed myself once, but I hit my hand with the hot iron, and I had a stage 2 blister there and burn. It eventually recovered. The skin didn't look the same right away, but eventually it remodeled, and you can't even tell that I had a triangular shaped scar there. That tissue was able to regenerate. The skin is very good at regenerating skin cells. So wonderful. But if that wound was chronically inflamed and it was infected, you're not going to have as nice of a scar. You might end up with a little scar and not normal tissue. So, patients with severe burns often have to have multiple surgeries because of the thick scarring that occurs because it's such a large area of their body. And then finally is the third option. And when you have chronic inflammation, that's what happens. It's not an environment where the cells can replace, or if there's that person who was underwater for 5 minutes, those brain cells died, it's going to be replaced with scar tissue or fibrosis. And if it was in your heart, then it's going to be called an infarction. Okay. A very common one in the physical therapy world is a person who has chronic Achilles tendon inflammation. And then one of those times they're going to do a big ballistic jump and it's going to rip right off the calcaneus because scar tissue in ligaments and tendons does not stretch or in muscle. Okay, so what we're trying to avoid is scar tissue. And the reason for that is that there's no cell there anymore. If that's your heart, that part of your heart's not going to work. If you can have the cell recover, resolution, or regeneration, if it's a liver cell, then that liver cell can perform the same function that it did before. The liver is very forgiving up to a point. My next video is going to be on non-alcoholic fatty liver disease, and we're going to talk about, it's called NAFLD. We're going to talk about that in great detail. So just to give you an idea, these are all the different drugs that are used to treat inflammation. And you can see across the top, you have ASA, which is aspirin. You have acetaminophen, which is Tylenol. You have NSAIDs, which is non-steroidal anti-inflammatory drugs like Aleve and Advil. You have glucocorticoids, which are steroids, and then COX-2, and they're prescription anti-inflammatories. But take a look at the left, and then you can go across. You can pause this video a little bit so you can see all the different side effects for each of these drugs. So I'm going to offer you a different solution. Instead of taking anti-inflammatory medications, I'm going to tell you to eat a low-carb or ketogenic, ketovore, or carnivore diet and reduce the inflammation in your body naturally. The thing about chronic inflammation is that those chemical mediators make fibrosis and scarring worse. And when that happens, you don't ever replace it or recover those cells, and you replace it with scar tissue, and you lose the function of those cells. So that could be your tendon, it could be your liver, it could be your heart. So let's talk about why excessive carbohydrates are a problem. So when you eat too many carbohydrates, especially sugar, white bread, pasta, cereal, sodas, juices, your blood sugar spikes over and over again, and your body doesn't like that. It only wants 5 grams of sugar or glucose in your blood at any one time. And imagine if you had this huge 100 to 150 carb meal. It's working like crazy to get rid of that blood sugar. So sugar, what happens is sugar will start damaging proteins. Think of sugar like a sticky syrup. And when it builds up in the bloodstream, it sticks to proteins in your blood, in your blood vessels, your nerves, your organs. These sugar-coated proteins are called AGEs, or advanced glycated end products, and send off red flags to the immune system and cause inflammation. Too much insulin turns against you in the end. Your body releases insulin to get the sugar out of the blood and into your cells. But when your carbs are constantly high, your cells start ignoring the insulin signal. And this is called insulin resistance. So it's like shouting at someone with earbuds on. They can't hear you anymore. And the cells can't hear the insulin anymore. What happens is that excess sugar gets stored as fat, and fat starts building up in places that it shouldn't, like around your organs, in your liver, in your pancreas, and in the muscle. That's what causes metabolic syndrome. And then sugar will mess with your gut. The high sugar diet damages the gut lining, kind of poking holes like in a coffee filter. And then what happens is that bad stuff starts to filter through and leak through your gut into your bloodstream, which also causes more inflammation. And then your immune system goes into overdrive and you're just in this inflammatory state. And then finally, that belly fat around your organs. I'm not talking the stuff you pinch. I'm talking about the stuff underneath your abdominal muscles around the organs. As you gain the weight from eating all the carbs, that fat tissue, especially the belly fat, starts acting like an angry gland, and it pumps out chemicals that keep your immune system in attack mode. If you take a look at this slide, this is by no means a comprehensive slide. There are more and more chronic illnesses associated with metabolic syndrome, insulin resistance, all caused from excess carbohydrate intake. But you get the central obesity, it causes insulin resistance. You get abnormal lipids metabolism, which leads to high cholesterol, high triglycerides. Um, the inflammation in the endothelial cells causes hypertension. You'll get non-alcoholic fatty liver disease. And again, I'm going to have a video next on that, but in stages 1, you can reverse it. But if you start laying down that fibrosis, it is no longer reversible and can lead to cirrhosis. That hyperglycemia causes oxidative stress and inflammation. And of course, you can get polycystic ovary disease if you're a woman, or type 2 diabetes. So it's a new day, and now that you have this new information, I hope you feel as though you have some tools in your toolbox and some hope, mostly hope, to know that so many people like myself have taken on a low-carb lifestyle and reverse our chronic disease. And trust me when I tell you, once you start feeling good, you never want to go back and take for granted how important your health is. So if this video made you rethink your relationship with carbohydrates, good, that was my intent. And I want you to know you're not alone. And that's why I started this channel, because I didn't have that information. And I was in the medical field and I was a professor, and I found this information out on YouTube, just like you are right now. And it's slowly getting into modern medicine in the United States and in the diabetic world and in the cardiac world. They're starting to recognize that a low-carb lifestyle is one way to treat diabetes and heart disease. If you're looking to start a low-carb diet on this channel, I give you tips of how to make it sustainable. I have a video about what to do before you get started, and also videos on good fats and bad fats, and many more to help you start your journey. My next video coming out is on non-alcoholic fatty liver disease. And I'll teach you to go back and take a look at your old blood work to see how your liver health is. And we'll talk about how the low-carb diet or ketogenic diet can reverse non-alcoholic fatty liver disease. It certainly did for me. So don't forget to hit that notification bell so you don't miss another video that's backed with scientific information. Hopefully I can teach you along the way to give you a better understanding so it helps you change your mindset to better health. Thank you again. Don't forget to subscribe. I appreciate you, and I'll see you in the next video.